All righty, we are going to get started. This is everything you want to know about COVID and the COVID vaccine. I want to thank you guys for coming today. My name is Dr. Crowder, also known as Dr. V. I've been an emergency medicine physician for 30 years. For any of you that are new to this presentation. And during that time, I've treated people across 4 pandemics and a mass shooting and 2 Category 5 hurricanes. So we put this together so that we can stay abreast of what's going on. The information is moving very, very quickly. I keep all of the source documents on AskDrV.us, and you can also follow me on Twitter, AskDr_V. So let's get started. The structure is a slide presentation followed by Q&A. We're usually done by 9 o'clock. Everyone is in listen mode. During the presentation, you can actually type your questions in. You can type them into the Q&A box, or you can also type them in under the chat icon. I check any of them. Also, if you think about questions afterwards, feel free to email me. Just go to ask.drv.us, and you can shoot me an email and ask me about something, and I may even make it a part of the next presentation. All right, so the webinar is set up to keep participants informed about COVID-19 science that will help them and their families stay healthy during the pandemic. The outcome is that you'll leave the webinar motivated to create or improve the action plan for yourself and your family. Or you may be motivated to create or improve an action plan for a broader community, like a church or a school or a union or something along that lines. This is just sort of where we are right now. We've got 91 million and a half or so total cases globally, with about 2 million COVID-19 deaths across the world. And of those 2 million COVID-19 deaths, in the United States, we are 4% of the world population, but we're roughly about 20% of the COVID-19 deaths. You can sort of see here where we stand next to other countries, UK, Germany, Canada, Mexico, and Japan. It seems like COVID is everywhere, and California is really having a problem. They actually had 2 gorillas at the San Diego Zoo test positive. This is the first known cases amongst great apes. Usually the animals actually have some immunity built in already to coronaviruses. So they've been infected, but they have not gotten sick. The vaccine, more than 25 million vaccines have actually been shipped. And we have administered 9 million vaccines. So let's get started with a couple of things. There's been a lot of talk about a collapsing healthcare system, and I want people to understand, what does that really mean, right? And I'm gonna do some slides on Thursday about how to really advocate for your family members if you have anyone in the hospital in this particular situation. So what happens as a healthcare system collapses, as you start running short of beds, and you start running short of staff, right? So specifically, you start using unusual places for hospital beds. So in LA, they're using the chapel and the gift shop. You have facilities that are running out of PPE, running out of oxygen, but most importantly, they're running out of nurses and doctors. You'll see sometimes ambulance diversions, a refusal to transport certain patients, or also long waiting times. If you call 911, long waiting times to actually get in. Other things that you see are increased times in the emergency department, where you can't, basically the inn is full, right? So you can't get upstairs to your bed. I know in California, they've started setting up criteria where EMS can pronounce patients dead in the field prior to transporting them to the emergency department. And in the state of California and across the country, hospitals are setting up ethics boards. And during those ethics boards, they're actually setting what is the new standard of medical care. So they're creating a new standard of medical care that is lower given the resources that we have. In addition, what they're doing is they're setting up criteria for physicians to withdraw care, even if the patient does not have a DNR. This is just an article. The New Yorker actually did the whole magazine is actually dedicated to COVID-19. What are some of the things we could have done differently? What are some of the things we did correctly? And it kind of looks at it sort of in retrospect. All right, now I told a lot of you guys I'm not flying. As most of you know, I put this slide together so you can see where are the airlines. So most of the airlines require masks, almost all the airlines require masks, and some of them, except for Frontier, Spirit, and Sun Country, make masks available. But not all of the airlines are cleaning the plane prior to every flight. In addition, most of the airlines are actually selling the middle seat. The airline that is not selling the middle seat right now is Delta, and Delta has made a commitment not to sell the middle seat until March. This just broke today. This is breaking news today. All international air travelers to the US will have to show proof of a negative virus test before leaving. So this is really, and it has to be, that test has to be done within 3 days, and they're going to need to provide written documentation. So there's concern internationally that the US is so infected that anybody that actually comes to the US is going to have to get a COVID test within 3 days in order to leave the US. All right, as we said, COVID-19 is highly contagious. Minimum time of exposure to infect others is 45 seconds. That's why we are now seeing congressmen that are becoming positive as a result of sheltering in place. So just that short, well, I shouldn't say short period of time. I think they had to shelter in place for about an hour and a half. I'm not exactly sure the amount of time. But they were not in a closet. They were in a fairly large conference room where they could walk around. But that degree of exposure is significant, and we will see more than the 2 congressmen that became positive become positive as well. About 60 to 80% of the people who actually come in contact with COVID-19 actually contracted. As we've discussed on this before, COVID-19 is both droplets and airborne. Droplets are larger particles that fall very close to you within 3 feet or so. Airborne particles are smaller and can travel further. So if you look and see what it looks like a little combination of the red and a combination of the gray. So if this person was COVID positive, we originally thought that COVID-19 only operated as droplets, which is the red. We've now found out that it operates as droplets and as airborne. So it operates as both the red and the gray. And as you can see, if this was someone that was COVID positive, it sort of shows you how with talking or singing or even just, regular speech, that a mask would be really, really important. All right, so how do I know if my family or I have COVID-19? There's 3 types of ways: PCR test, antigen, or CAT scan. PCR test is the gold standard. That detects genetic material, and that is a swab that goes up your nose. It's kind of painful. It's most accurate 8 days after exposure, but it can be inaccurate if it's administered too soon or too late. The antigen test is not as reliable. This is the rapid test. Usually they're swabbing the side of your mouth. It's fairly easy, not painful, but it tells you 30% of the time that you're negative when you actually really could be positive. So I recommend that if people get the rapid test, that they get at least 2 rapid tests before they decide that they are actually negative. I had someone who wanted to come visit me. I required them to get 3 rapid tests. And then I said, okay, you can come visit. Now, CAT scan is another way that you can diagnose. So sometimes people are negative, and they still are having symptoms. So we do a chest CAT scan. And so on this chest CAT scan, you kind of see with the yellow arrows there, white streaks on both sides of the lungs. Those white streaks are what they call ground glass opacifications, and that is what is associated with COVID-19. Now, interestingly, dogs are actually the most accurate in actually detecting COVID-19. They are actually more accurate because COVID-19 has a scent to it. Dogs are actually more accurate than any of the tests that I've just shown you. There's a home rapid test now that recently got FDA approval, and you can get it on Amazon. It's called Dexamethasone, and it is a rapid. So this is a COVID-19 saliva test, and this is a rapid test. You still have to return it and ship it to the lab. It is a PCR test, and this recently received emergency FDA approval, and this test is available on Amazon. Now let's talk about the clusters of symptoms. Cluster 1, 2, and 3, those are symptoms that you normally actually can go home with or just treat COVID-19 at home. These are symptoms where it's loss of taste, loss of smell, maybe loss of appetite, and flu-like symptoms with a fever, without a fever, or also gastrointestinal symptoms, which are more abdominal pain, diarrhea, etc. Cluster 4, 5, and 6, these are the ones that often happen to be hospitalized. So fatigue is a very, very strong indicator of someone that actually needs to be hospitalized. As it gets worse, it will also become confusion. Then if someone has respiratory as well as abdominal symptoms, that is usually someone who's having a severe bout of COVID-19. This chart here just shows you how often certain symptoms occur. And I show this to you so that way you kind of see that, you know, if you look at fever, you've got about 22% of the time where there is no fever. So if you're doing temperature checking, which is a good thing to do, you will have 22% of the time where you will miss someone possibly with COVID-19. Cough is about 50%, fatigue about 30%, loss of smell 25%. So as you see, this from this chart, COVID-19 can really present as several different constellations of symptoms. Now, I get a lot of questions about the flu versus COVID. I just wanted to sort of use this chart to explain the flu is a respiratory disease. COVID-19 is not a respiratory disease. I want to make sure that COVID-19 is a multi-system disease. It impacts your heart, it impacts your vascular system, it impacts a lot of different symptoms, even your renal system. So I want to make sure people understand it's a multi-system disease. Now with the flu, we have anywhere from, like, the worst flu year we ever had was about maybe 30 to 40 million people getting it. And in that year like that, there might be 70 or 80,000 people that would die. And the worst, that's the worst year of the flu. COVID-19, we've had 16 million people get it. This is in the last 9 months. We're now at 380,000 people dead. At the time I did this slide, it was 308. But as you can see, it's a much, much deadlier disease. You know, we will probably we will sometime this month cross over to 400,000 people dead. We've never, ever, ever had 400,000 people dead in less than a year from the flu. What else makes COVID-19 distinct? So a couple things. It's so contagious that we've had to shut down elective procedures. We've never had to have to do that for the flu. Also, almost 100% of the ICU beds are now COVID patients. We've never seen that from the flu. As I said, COVID-19 is a multi-system disease and infects your heart. It causes strokes, blood clots, etc. We have people with COVID-19 that are in the ICU that require ECMO, and after they actually survive, they wind up needing a double lung transplant. We've had a lot of patients now get double lung transplants. That is not something that you see with the flu. So it is clearly distinct. And we'll talk a little bit more about ECMO. But first, let's just talk about what happens if I just get COVID-19 positive. What do? You want to make sure you have a pulse ox at your home. The pulse ox there is very important. The first number, which says 97, that is your oxygenation. If you're a normal, healthy person, normally it should be higher than 95. If you're a smoker or you're elderly, it might be a little bit lower, 94, 93. But in general, it should be in the high 90s. So anything that is less than 95, you then want to actually really call your doctor and get some medical attention. Zinc and vitamin D3 are things that everybody should be taking, even if you're not COVID-19 positive, because you want to make sure you have good supply of both of those in your system if you happen to get COVID-19 positive. Now, if you actually become positive, you want to make sure that you have a room that you can quarantine in, a bathroom that's only used by yourself. People leave food at a closed door. You want to open up the windows. If you live with other people, you want to get a HEPA filter, and make sure you have a cell phone in your room. If you have a cell phone and you feel like you're getting in trouble, you're going to call 911. You're not going to call a family member, because if you call a family member, you will make them COVID-19 positive. All right, so let's talk about some of the treatment plans associated with COVID-19. These are some of the things that we're going to actually go over. I talked about the pulse ox, and obviously you see people actually on TV getting oxygen when their oxygen level gets low. Vitamin D and zinc are things that you can either get through your own nutrition, or you can get supplements in any sort of GNC. But let's start talking about famotidine. Now, everybody knows what famotidine is. It's Pepcid AC. Now, even though you're not having stomach problems, what Pepcid AC does is it blocks histamine release. So COVID-19 actually causes inflammation in your body, and Pepcid AC blocks inflammation in your body. So it's been associated with lower hospital deaths and lower intubation. Dexamethasone is a steroid that also blocks inflammation. Remdesivir, you hear people talk about, it's really questionable benefit, and some hospitals and facilities are not even giving it anymore. Regeneron is the name of a company, and it makes an antibody cocktail. Now, Eli Lilly also makes an antibody cocktail, and both of these are monoclonal antibodies that actually bind to an area of the spike protein that really helps them, that then prohibits the virus from attaching to your cells. So Eli Lilly's antibody cocktail was got emergency FDA approval on November 10th. What is really important about this is these decrease hospitalization by 70%, but you must get them within the first 10 days. So where do you find them? So you find this at an infusion center. Certain hospitals have infusion centers. So if you get COVID-19 positive, or you think you might be sick, you want to actually know who has the antibodies. This is just a screening tool that's used at most of them. If you're over 65, as you'll see to the far right, without any medical complications, you are eligible for antibodies. If you're between 12 and 64 years old, then you're only eligible if you have certain diseases: chronic kidney disease, diabetes, immunosuppressive disease, or if you have a body mass index over 35. Now, if you look at the top left-hand corner where it says positive COVID-19 test results, then the next thing it'll say is symptom onset within 10 days. This is really important. If you stay home too long and it's been more than 10 days with symptoms, you cannot get this, monoclonal antibodies. So it's very, very important that if you think you're sick and you feel like you're getting sick and you have any risk factors or you're over 65, you go straight for monoclonal antibodies. Now, a lot of people have asked me, what is ECMO? So let's talk about it, because it's got what happens with some people when they actually are not able to get enough oxygen on the ventilator. So ECMO stands for E, extra, C, corporal, M, membrane, O, oxygenation. So basically what this is outside of the body, you're going to actually get oxygenated. Some people also call it a heart and lung machine. This is what it looks like. You cannulate the vessels going into and out of the heart. You take the blood out of the body through tubing, oxygenate the blood, and then bring it back into the body. Well, obviously, while this is going on, the person is in a medically induced coma. So this is used for the sickest patients and also for the youngest patients. Normally, a hospital, a very, very, very large hospital center may only have 6, 7, or 8 ECMO machines. A community hospital out in the suburbs might only have one or two. So these are precious resources, and they're really reserved for the sickest patients and the youngest patients. All right, just to show you this woman, she lived through the flu in 1918, and she actually caught COVID-19 twice. A lot of people actually talk to me about, can you catch it again? And you absolutely can. Your antibodies do decrease over time. Right, so now let's talk about the vaccine. Basically, the way COVID-19 works is the orange is the virus, the yellowish orange is the viral RNA. The orange, like Halloween orange, is the spike protein and the fatty covering around the virus. So the spike proteins bind to the receptor. Once they bind to that receptor then lets it into the cell. Once it gets into the cell, it actually tells the body through using RNA, begin to make copies. So RNA basically acts like a copying machine that tells your body to begin to make multiple copies. So you begin making multiple copies, you form a new virus, it leaves the cell, and it goes out and infects another cell. So that happens over and over again. So RNA, you hear a lot about RNA. There's multiple RNAs. We're going to talk about messenger RNA because messenger RNA is what they're actually using for the vaccine. And that actually transfers genetic information from the genes to the ribosomes, so it actually synthesizes protein. So messenger RNA, both the Moderna and the Pfizer vaccine both use messenger RNA. And basically what that is you get vaccinated, and then that messenger RNA tells your body, hey, make this spike protein. Don't make the whole virus, just make the spike protein. So then your body makes the spike protein, your body recognizes it, and your body creates antibodies and attacks it and kills it. So then when your body sees it in the real community, you do not get sick from COVID-19. Johnson & Johnson, which should be completing their vaccine trials probably sometime this month, the beginning of February. They actually use what's called a viral vector approach. So they basically combine adenovirus with some genetic material from COVID-19, and it teaches the body to generate antibodies to the spike protein, but doesn't allow the body to get sick from COVID-19. This is a one-shot vaccine. So let's talk about all the different things associated with it. The Pfizer is 2 doses, 92% effective. It has to be stored in liquid nitrogen, and it's soreness and fatigue, that sort of thing. Moderna is 2 doses, 95% effective. Muscle aches and fatigue, but you can actually store this in a regular freezer. Now, there's been a lot of talk about who's going to get the vaccine first, what are we going to do? And there was this whole framework for equitable allocation. Today, they decided we are not using this. So basically today, the CDC came out and the Trump administration reversed course and decided to adopt part of the Biden vaccine distribution plan. So what does that mean? As of today, if you are over 65 years old, you can get a vaccine right now. So if you are 65 years or older, you can get a vaccine right now. And I will actually show you how to find where you can do that at the end of the presentation. It's very important to know that when you actually do get vaccinated, that it prevents you from getting sick, but it doesn't necessarily prevent you from transmitting the virus. So people who get vaccinated still need to wear a mask. In Los Angeles, they have a lot of healthcare workers who have gotten vaccinated, and they're telling them it's important for them to wear a mask in their home because they can still transmit COVID-19 to their family members. These are the vaccines that are to come: Johnson & Johnson, AstraZeneca, and Novavax. Novavax is actually being tested at Howard University. There's been a lot of talk about the mutations. So I want to just talk about the mutations shortly. There's one from UK, which is very, very, very contagious. And we're seeing patients with high viral loads. It looks like the Pfizer vaccine and probably the Moderna vaccine, but for sure the Pfizer vaccine are actually going to work with the UK variant. There's a South African variant that is also more contagious, associated with high viral loads. The South African variant as well is making children sick. So this is very, very important. If you have children, the South African variant is making children sick. We do not know if it's here, but we suspect it's here. The only reason why we don't know is because we don't have a public health care system that's actually set up to do genetic testing like other countries do. The South Africa variant actually has a lot of mutations, and it's not really certain which will work or not work with as far as vaccinations. There's a Nigerian variant that was just discovered over the holiday, and I think they just completed recently genetic sequencing on that. So we don't know that much about that yet. World Health Organization warns that COVID-19 will not be our last pandemic, and that we really need to get together as a world and as multiple countries to really have a unified approach to pandemic preparedness. All right, so how do I get my vaccine now? Here is what you need to do, and I'm going to actually show you guys how to do this. So the new criteria is that you must be 65 years or older. Now, if you can be younger if you have diabetes, kidney disease, etc. But if you're a healthy person with no medical problems, you have to be at least 65 or be a healthcare worker. All right, now you have to search for your county public health department, put in the search criteria COVID vaccine, and look for the instructions to schedule your vaccine. So what I'm going to do is I'm going to show you what I did. All right, so I am currently right now, hold on just a second. I am currently right now in Dare County. So I did Dare County Public Health Department. All righty, so I pulled up their website. Right now, I was to the search criteria and I just put in COVID vaccine and I see what comes up. All right, so now, and they're gonna have all this stuff about this phase 1, phase 2, but remember, we're not doing that anymore. So now all you have to do is call the phone numbers here. This is what I did. And I called one of the phone numbers. I have, how do I make an appointment? Usually in the frequently asked questions right here, how do I make an appointment? And they actually, sometimes they have a link for you to complete a form online. I would do this now because they are going to take people on a first come, first serve basis. Sometimes you can actually make the appointment now, but a lot of people right now don't realize that you just have to be over 65 years old. So I would actually tell people, make the appointment right now, send them your information, call them, and go get your vaccine.